And so what does it mean to flip a classroom? Now, for any course that the student may sign up, which is not an online course, what usually happens is that the delivery of the course material happens in the classroom. And any work that the student might have to do, it would be homework or other assignments that would be done outside of the classroom. That would be the traditional model. Okay, now in a flip model, what happens is that this instructor will create a video for the students to watch. This is one form of it. And the student will have to watch it before they come to class, so they learn to the best availability what's in that video. When they come to the class, that video, the material in it will be clarified, it will be explained, it will be expounded, and it will be reinforced by student-centered activities which the instructor provides. For this strategy of learning to be successful, beyond doing the flipping part that I just described, the student or the instructor who designs the student-centered activities must do it so that it'll increase student engagement, and it also will promote active learning. And at the end of the lecture, there must be a follow-up, a follow-through, in the form of an assignment such as homework. When framed in this manner, flipping the classroom can bring very nice improvement in student success and student retention. Now, we teach different subjects and we teach different courses. For each of us, flipping, for flipping we have a different version and we have a different vision for it. But overall, all of us are flipping our courses. Our goal is to promote student-centered learning, and the overarching goal is to improve student success. This morning I will tell you about my experience in the chemistry course. Katie will follow by talking to us about her experience in nursing courses, and Martha will talk to us about her experience with history courses, and she will also wrap up. Now, for my situation, I teach an introductory chemistry course. That is a required course for a nursing student and pre-radiography students. We have about 300 students sign up each semester for this course. Historically, this course has two problems: poor grades and poor retention. So I came to teach this course the first time in fall of 12. I knew this problem. So I came with clicker questions to engage my students and encourage them to learn actively during class time. And I asked them to do homework, I gave them quizzes, and I gave them all the lecture notes that I have, all the slides, and then the regular things, office hour and email. And at the end of the semester, I saw exactly the same thing. Okay, so poor grades and poor retention. So I had to do something about it, the way I manage this course, in order that it will come out better. Okay, so I thought, okay, how can I do it? So during the semester, I observed the following. My students are not good in math. My students don't like to do homework. I'm sure yours do, but mine don't like to do homework. So in order to keep up with the lectures, this is a problem. After a while, they couldn't keep up with the lectures. In a meaningful way, they can maybe answer clicker questions, but it's not really meaningful engagement. After a while, they get frustrated, so they quit. Okay? Now, well, they quit, and those that didn't quit, they have similar problems, therefore the grades are poor. So I thought, okay, to kind of save myself in a way, what I should do, perhaps, is to find a way to maximize student engagement in and out of the classroom. That way, maybe I can improve the student learning outcomes, and then the retention rate might increase. So what I'm looking at is to foster continuous student engagement, okay, throughout the semester. Now, I use the four-tool approach. The first thing I did is that I made it mandatory for students to watch the videos that I prepare, which I call mini lectures. And then I asked my students to do homework after each lecture. So this homework is in sync with the lecture material. And then I gave a quiz at the beginning of every lecture. What is a quiz on? The quiz is on the homework. And on the mini lecture, if they had to watch one for that lecture. And then during the lectures, I asked them to do clicker questions, because these questions will help my students to be engaged. Their heads will be in the class, and that it'll help them to learn actively. Learn the stuff while you're in the class, okay? And it also teaches me whether the stuff I just taught, they understood it or not. So now I'm going to tell you a little bit more about these 4 tools that I use. Now, why did I come to this way of doing things? Actually, my students helped me. In the student evaluation of the fall of 12, they asked for extra lecture time and asked for group work time during lectures. Now, I cannot just increase the lecture time of my courses. So many lectures, they provide this needed extra time. Because this extra time is kind of free. They do it on their own time. I provide the videos. And because of this extra time, there may be time freed up during the classroom where we can do group work. So by doing this mini lecture, I answer both of the students' requests. Now, these mini lectures, I'm doing 15 to 25 minutes each, and I don't do it on everything. I only do it on confusing and challenging topics only. I try to go very detailed, very slow in these mini lectures, and I try to explain concepts and solve problems in different ways, using different approaches to accommodate different learning styles. Now, these videos, of course, can be watched many times by the students as they wish. Now, as I said, this essentially opens up some time during the lecture for group work. In this way, it flips the classroom partially. I intended not to flip my whole class because I think if I did that, my student wouldn't come to lectures. So I gave quizzes. Quizzes are to encourage students to complete homework in time and reward those students that watch the mini lectures and that get the gist of the stuff before they come to lectures. So to reward those students. Now, to maximize the impact of this plan, I felt that these 4 things I'm trying to do, they must work in sync, okay? They not be just silos by themselves. They have to connect, right? So the timing is very important. So here is a way to do it. I start with the first lecture, and this lecture has its own clicker questions. So at the end of the lecture, the student will have to do homework. And if the next lecture has a mini lecture associated that a video I make, they have to watch that also. So they come to the next lecture. What happens first? They have a quiz. Quiz on what? On this homework here and on the mini lecture they're supposed to watch, okay? And then that lecture itself has its own clicker questions, so they answer that, keep their head in the room, okay? And then there will be homework associated with the second lecture, and also if there's a mini lecture, they have to watch it for the third lecture. We come to the third lecture, same thing happens. There's a quiz on the stuff that was going on before and the mini lecture, if there was one. And then they go home after the lecture. They have to do homework. So I would go like this the whole semester. So then you say, hey, that's a lot of work for you. It's a lot of work for your students. So how'd you survive? So I don't know how it's going to happen. So, so I kind of work this way. The best angle from which to approach any problem is the triangle. Just try it. So what I did was that I was scared, right? But I kept going because I felt that if I don't do something, the same result will happen, right? I will get still poor retention and poor student success. So what was I scared about? It took me the entire semester. I didn't have any spare time to go through that course the first time. So I'm putting all these quizzes in there. Am I not cutting myself short so that I cannot finish the course? Of course I'm scared. What about my students? I'm working them in a way that they never had to work previously in their life, probably not for school anyway. So they may flip out on me. So what does that all combine to do to me? Well, I might do really something really harmful to myself as a teacher, right? Okay. So these are all fears in my heart. But something pushed me to go on. Maybe it's being courageous, as maybe being stupid. I don't know, okay? So now I'm going to show you some data from the way we've made our exams, comparing the results from the fall and compared to what happens in the spring. So we give 4 exams in our class, 4 kind of midterm kind of things, 100 points each. The final exam is worth 200 points, okay? And then we have an assessment exam, which everybody who takes the course has to do. Okay, so now here is the score from the first exam. I'll show you how to read this thing. Okay, so now here we go. Looking at this bracket that says 65, this is saying that The blue one tells me about what happened in fall 12. So in fall 12, 9 students got between 60 and 65. So these are bundled in 5s. And in the spring, 2 students got in that same bracket, 60, 65. So now in the bracket of 80 to 85, there are more students who got that in the spring than the student in the fall. So now if you look at the general curve for the fall versus the spring curve is much shifted to the right. This you see also in the averages. The average improved by 21 percentage point, which is 35% improvement. That was to my amazement, really. Now these are number of students who started that just fortuitously was the same. Okay, so now I've done something like this to my student in other schools before, but never with that video component. The best I could get was about 18%. So, but I'm cautious about this result because this stuff is on the easy stuff, okay? So the second exam is when we have challenging concepts in chemistry, and that associated with challenging mathematics, and it requires critical thinking to some much deeper extent than the first exam. The first time I gave this exam in fall of 12, my student averaged 39. So now I gave this exam again, a similar exam, not exactly the same. Now this is what happened in between the fall and the spring. You see the average increased, right? Now by quite a lot. And you see the number of students who took it, already we have better retention compared to the first semester when we taught it in the traditional way. Now you see now the average obviously shifted towards the right, okay? Now, this is 51% improvement, which is also to my amazement. Now I will show you the same graph represented by using area under the curve. This is what happens, okay? So this is the area under the curve for the fall, so there's one peak here. But for the spring, how come there are 2 peaks? Now, the student who scored 65 or above, 90% of them did 70% or more of the homework. The students who scored 50% or below, almost all of them did less than 50% of the homework, or they didn't do any homework. So what's the lesson? You have to do your homework, right? So now, in fall, when I taught this course, last fall, my students were not doing very much homework. So I showed them this graph, okay? I told them, okay, you want to be here, you want to be there. That's your choice. So I told them this about 2 weeks before the exam. They took the exam, and this is the result, okay? So they decided they will do homework, okay? Because the delineation is about the same, right? So homework has a lot to do with student outcome. You can teach it in a new way, yes, but if you don't do homework, it does limited amount of good. You do homework, it gets better results. And this is also reflected in exam 3. Here you see what happened when I didn't have the video lecture, I didn't follow up with homework. You see the average is about here. When I did have some homework there, now when I show students how to do it, or why do your homework, then the improvement was substantial. Now this shows you the results from the 4 exams for the semester. Now in every exam, students improved using this new way that I'm managing the course. So that was gratifying. But you can ask me, how long does these improvements last? Does it last for the exam? Yes, it does. But what about the semester? Okay, I am also curious. So here I show you the final exam outcomes. For the fall semester, 95 out of 200. For the spring semester, 125. So that's substantial improvement in the final exam. This is the final exam that I gave, not the assessment final. Now, so you see the median increased and it's greater than the average. That means more students relatively got higher grades than the average grade. And the important thing here, I feel, is that, look, the number of students who took the test. In the spring, there's 51. In the fall, there was 40. I started with the same number. So there's substantial improvement in student retention. Now let me show you the distribution of this exam. This is the distribution, done the same way I showed you before. So you see what happens is that the average increased like I showed you before. Now there are many students who got higher grades that students in the first semester didn't get, but there are lots less students who with poor grades. But I had more students taking the exam in the spring than in the fall. Now, this shows you, so you say that one is the exam that I gave. What about the assessment exam? This is the assessment exam given by the ACS exam, for the GOB type of chemistry. All right, so now in the fall, is in the blue, so the average is about, 18.4 here, all right? In the spring, now the average is 22, so it shifted to the right again, okay? I have some high scores. Now, in the spring, this is what happened, you see? Because I nudged my student to do homework more than I did last time, well, the average improved. Okay, so now we have a 32% improvement over what was originally. So these data are all very gratifying. So now I'm going to show you how I manage these different things a little bit. The mini lectures I did via the Echo 360 provision that is available at PCCC, which I'm very grateful for, but you can do it other ways. For me, I had to edit the recording, and then I sent the link to my students by Blackboard, or I send them an email with the links. Now, the lecture quizzes, I use, very often I use the turning point technology thing, okay? But I make the questions always myself. It's never any commercial questions. And then sometimes I use the clicker response. Sometimes I ask them to write in a piece of paper their answers, because some parts of the course, you can be a good guesser and get a good score, but you actually didn't learn that much. So I want to avoid that. Now, during the lectures, the clicker questions, they help students to learn the gist of the material. Where did I get those questions? Yeah, I use publishers' questions and make my own also. And it checks students' understanding, and then it's useful for group work, and sometimes I use it to deliver new material, discuss new material. Now, what I do in the flipped part of the classroom, several activities. Individual problem solving, something on the board I'm working with, so it can be solved by clicker, and I can ask individual students for their answers. And then I have group work for the students, so I have maybe 3 or 4 questions which are of a similar nature. I will group students in 3 or 4s and ask them to answer this one, that one assigned, okay? I'll go around the room and try to help students who need help. So this might take some time, sometimes 10 minutes, sometimes 5, 7 minutes. Now at the end of that time, I will ask students to put their answers on the board, like within the next 45 seconds. You can't stand there forever, right? Okay. So then why should I go up? Well, because you'll get extra credit, that's why. They all go. Now, online homework menus, what I do, I use OWL, because that's a system that gives me randomized problems. That means that I don't get the same questions as my neighbor who is working on the computer right next to me. No cheating, okay? Gotta do your own work. Now, what do I have to do for the OWL? I gotta set it up, right? Get an account, decide what I consider to be one successful assignment, and then I have to monitor the progress. What does that mean? From time to time, I send emails to students, tell them, hey, you gotta do more OWL homework if you think you're gonna pass this course, like that. So now here, by doing like a lot of this kind of stuff, LOs are improving, and things seem to go pretty good. But what do my students think? Okay, let's see. In the middle of the semester, I did a survey because I thought it was a lot of work for me. What are my students thinking about? So I asked them, the most useful component to the lecture, complement to the lecture is, the majority of students said homework, okay? Not surprisingly. But they recognize that mini lectures is helpful, so it's the clicker questions during lectures. Well, next question I asked them was, to improve my learning from the current level, I would like to see maybe more homework, huh? Mini lectures, right? So that means I have to keep on doing my mini lectures, which I did. Okay, so some students said everything's going good, and some students said, so more questions in the quizzes. Only 1% of the students says more homework, please. Okay. At the end of the semester, we did a third-party survey through Echo 360. So they asked students certain questions. One of the questions, the statement they made was, mini lectures helped me to stay in class. I otherwise would have dropped student retention. So how did the students answer? The student agreed with this to 50%, to extent of 50%, either strongly agree or agree, okay? So this method of managing class is helping with student retention in their own voice, okay? Now then, that same survey asked other things. One of the things says, I view mini lectures multiple times per week. Most students did. And then it says, okay, mini lecture helped me to what? Revisit, clarify complicated, confusing topics. Yes, it did. So I can watch it many times. I can learn it at my own pace. I prepare exams using it. I can use my time more efficiently. These are this percentage of agree or strongly agree answers. And many students voiced this sentiment at the end. That is the best experience ever. I loved it so much because it helped me to prepare for both exams and lectures. Okay, our students full-time is, well, part-time is slightly exceeding full-time students, okay? Or I should say not PCC student, but that student that participated in this survey. My age, 40% of my students were non-traditional students and 60% traditional students. Well, how much do I work a week, like outside of school? About a third of my students, they're full-time students. 2/3 of my students are part-time students, and about a tenth of them work full-time. And so to sum up, what I have tried to tell you is that I use this 4-tool approach in SYNC, which has in it the flip-based learning component. What was I doing with it? I tried to create an interactive classroom experience based on active learning, and I used continuous student engagement between lectures. In this way, I hope to promote students to be responsible for and to take ownership of their learning. And the result has been encouraging, as you've seen. From the semester exams were vastly improved from previously, and the final exam assessment and grade exam over 2 semesters agree with each other, and in the same ballpark, also the student retention rate was increased. And so what about my fears in the beginning? I was able to finish the course in time. That was not an issue. And I am very grateful that my students had very positive feedbacks from their experiences, and that they did not flip out on me. And so now here's my email information. If you like to, I would be glad to share with you my what 2 cents I have worth about flipping classroom. So now Katie is going to continue our session by telling us her experiences in the nursing courses.
I'm very excited to talk to you all about the experience that I've had using some of these ideas in my nursing courses. I teach in the evening program, so a lot of my students are a little bit older, they have jobs, they have families. So this has been really good because a lot of times they're tired in the evening when they come to class, and passive learning doesn't work as well as active learning techniques. And then they love to watch the lectures on their own time when they are well rested. So it's worked out really well for that. Also, because it's evenings, it's a smaller group. I have about 20 to 25 students in each class, and I teach Nursing 3 and Nursing 4, 201 and 202. So I get them in their final 2 courses before they graduate. So it's an exciting time because they're about to transition into being on their own, caring for patients. So it's a very exciting time. So the situation in nursing education is that, of course, we all want to improve outcomes, regardless of our discipline. We want to improve outcomes for our students. And one of the best ways in nursing to evaluate student success is to look at the pass rates for the NCLEX exam. The NCLEX is our national licensing exam for nursing. So, of course, when they graduate from our program, we want to be sure they're well prepared. Now at PCCC, our rates are good. Our pass rates are very good, but we always want to improve that. So, of course, there's always room for improvement, and we're wanting to bump that up a little bit. Also, nursing is a practice-based degree program, meaning that it's not just about how much we can get into their heads by the time they leave us. It's about how well they can take their knowledge and use it in situations with real patients. So being able to bridge this gap between classroom and the clinical setting is really important. So that makes us a little bit different. And for that reason, I wanted to look at these flipping techniques. These are some of the challenges that we face, right, in this practice-based program. Clinical opportunities are limited, and this is a problem, I think, for every hands-on profession. I'd love it if we could give our students 20 years of experience in their 2-year program, but of course that's not how it works, right? Hands-on is the best way to learn, but we can't count on it completely. We might get wonderful placements on a medical surgical unit that's very busy, but we can't guarantee that every single student is going to get to work with a patient in liver failure, spinal cord injury, multiple sclerosis, and so on, right? But all of our students need to be able to care for patients with all those conditions. So how on earth do we do that, right? So this is something that we're always looking at. Hands-on is the best way to learn, but we want to find other ways to reinforce learning as well. So we're always looking to bridge that gap between classroom learning and clinical excellence. A few of the other things that I've noticed are similar to what Linda's noticed in her students, which of course become my students too, is that math proficiency is lacking, which is very important in nursing, right? How many of you want to be in the hospital and not be sure if your nurse calculated your medication dose correctly? No, okay, I didn't think so. So it's very important, right? We also are looking at follow-through during the semester, right? So students tend to study what's on the next exam. They're not really viewing content as cumulative. I'm sure you guys don't have that problem at all either with your students. No, exactly. Students tend to have difficulty with exam questions that require higher level thinking, right? So everybody loves it when they get a nice rote recall question. But what we want is nurses that can really think like a nurse, that can really do critical thinking. And so that's where we're putting more and more of our attention. So there's a lot of solutions out there. One of the biggest one in the nursing literature right now is simulation, which is a wonderful tool, right? Having students practice things hands-on in the skills lab or doing simulation scenarios with mannequins. And that's a wonderful thing. It's something we're integrating more and more into our curriculum, which has shown good effects. But I wanted to know if I could do something else also to help improve our outcomes even more. So I looked at classroom flipping techniques when I was inspired by Linda Chang last semester. So this is something that I think can help additionally as well. So similarly, we have our before class activities, right, which is, of course, their assigned readings, as we've always had. But then the lectures, I also use Echo 360, which is available at our institution, which enables me to record the lectures ahead of time so that the students are able to watch them on their own time. At home, when they're well rested, they can rewind and re-watch again any parts that are a little bit more difficult for them. So they really appreciate that. So they do that at home, and then they come to class ready to go. And then we get to do our active learning exercises, which is where it really gets interesting, really gets exciting. So the lectures I either email the link to the students or I post it on Blackboard for them. I've tried full and partial flipping, and I don't really have a clear favorite yet, but for some of the topics, it seems to work well to do a partial flip where I do about a 15, 20, 25-minute lecture and then come in and review and do the rest in the class. Others, I go ahead and do the full lecture, which only takes about an hour outside of class because there's not as much discussion, of course. And then they come in and we spend the whole class time doing our activities. So both, I think, are good options. They can be used at different times. So before I decided to flip my classes, I thought I would see, has this been done in other allied health professions, right? And how well did it work? So I didn't find any studies specifically about associate degree nursing programs using these techniques, but I did find a lot of studies for other disciplines that share a lot of our goals. So in nursing, it's been used for baccalaureate as well as PhD courses. It's been used in physiology courses, and it's been used in education for pharmacists and physicians. And they did find a lot of really good benefits. Basically, the students did better, the students liked it, and it freed up time to teach higher level thinking, which is what we really want from our clinicians of the future. So then moving into flipping my own classroom, there are a lot of ideas that I had. I was eager to try lots of different things. These are the things that I found worked the best. So this is what I'm going to tell you a little bit about now. I like to start each class, of course, going over any questions. So they viewed these lectures at home already. Do they have any questions about it? Was there anything unclear? A lot of times they're a bit hesitant to speak up at this point. Sometimes they do. But then next I go into these NCLEX style practice questions. Now again, the NCLEX is our licensing exam. So questions in that style are critical thinking questions. They're higher level thinking questions. So it's a great chance to do a lot of different things. Work on test taking strategies, prioritization, and then also I can verify their understanding of the content that I taught. Sometimes there are misunderstandings that happen, so that's a great way to sort of uncover it if they're hesitant to ask questions at the beginning. So once we've done some questions, then I like to divide them into groups. Oh, and I left my deck of cards over there. My favorite way to do it is with a deck of cards, just your plain, basic, bicycle, poker, playing cards, right? What I like to do with that is make a little mini deck with a number of cards that's the same number of students I have for that day. And then I shuffle the deck, pass a card out to each student, and they're all kind of, holding their card and, being a little secretive about it. So it feels a little bit like a game, but then all the 8s find each other and get in one group. All the queens find each other and get in another group, and so on. And the students like it because it feels a little bit like a game. It's a little something different. I like it because it's 3 to 4 students in a group, which is a really nice size for discussion, and because it's randomized. So they end up working with different students than they normally would, which gets some really good discussion going. So once they're in their groups, there's a lot of different activities I like to do. I like to mix it up a little bit. Pictures, videos, case studies, communication exercises. So I'll tell you a little bit more about these now. So pictures and videos, what I like to do with this is just as an example, when I was teaching the lecture about hematology for newborn babies, I put up a lot of pictures of newborn babies and said, now which of these pictures shows a newborn with a risk factor for hyperbilirubinemia? So to answer that, they have to be able to, first of all, know what the risk factors are, which is the recall, but then they need to be able to recognize it on a picture of a real person, right, which is a form of application. So anybody in here have any idea? What do you think? The one on the left? Good, that's correct. Yeah, actually there's 2 up here. So the one on the left, I know, trick, right? I got you. So the one on the left, they should know that prematurity is a risk factor for high levels of bilirubin. And they can tell that's a premature infant by the lack of fat storage and also by the lanugo on the shoulders. So these are things that they need to be able to recognize and apply, right? The one in the middle, that's a Mongolian spot, totally normal finding, right? It's a normal variation. And on the right, that baby with the little heart-shaped head has a bilateral cephalohematoma. That's actually blood underneath there, and as it absorbs, it can cause the problem. So anyway, all that just to say that this is a way for them to apply their knowledge, and it can stimulate some good discussion. Then once we've done that, we can look at some videos. So for this, of course, phototherapy is one of the good treatments for that, for hyperbilirubinemia. And so we look at YouTube videos of babies receiving this therapy, and then I have them write down, which one do you think got the best care? What about the care that these babies received was really good? What about it do you think was not so good? So in this way, they're actually critiquing the care a patient receives. It's an analysis of care, which is one of the higher levels of thinking, right? That's evaluation. That's understanding the care so well that they're actually able to critique something that they see. One of my other favorite things to do is unfolding case studies, and this is something a lot of the students have said they really enjoy as well. So what I like to do is each group, and whether I have 4 or 5 groups, however many groups, they'll each have a different piece of the scenario that they'll work on. So I'll have the demographic information for the patient that I make up on the overhead, right, on the PowerPoint, along with a nice picture to make it feel kind of real. Then I give a slip of paper to each of the groups with their part of the scenario. Give them a few minutes to work through their ideas, and then we go through each group one by one. Now, group 1 might have Mrs. Smith when she was in an outpatient clinic, and got diagnosed with preeclampsia, so they need to give her some teaching about how to manage it at home. Group 2, she's not doing so well, she ends up in the hospital, they need to prepare her room. Group 3, she starts having seizures, how do they manage that? And so on. So they actually follow this patient all the way through their stay. So it's really kind of fun for me to make up these scenarios and then for the students to work through them, and it can trigger a lot of discussion. Of course, any math calculations, everybody does, not any one group, because they all do very well with lots of practice. Another thing I like to do is therapeutic communication exercises. So the fact is, believe it or not, it's really hard to talk to patients because they don't always do what's in the book, right? What do you do if a patient yells at you? Or what do you do if a patient flirts with you? Or what do you do if a patient tells you that they might be thinking about suicide? Right? It's difficult, and in that moment you need to have a poker face, and you've got to stay client-centered, which can be very hard to do. The best way to learn this is to practice it. That's really kind of the only way to learn it, right? So I like to give the students a chance to practice this in a safe environment. A lot of times I'll be the patient and I'll be a little bit ornery, you know. But there's lots of different ways to do it, which can be a lot of fun and really helpful for them. So I found it to be quite useful already. I find that it does give me a chance to work on those higher levels of thinking with the students. The students do seem to really like it, and they seem to be doing better also as well. But basically, with these student-centered activities that I do in the classroom, I found that I'm able to access every level of Bloom's taxonomy, which is really exciting for me as an educator. Student satisfaction. I did a survey at the end of each semester, last fall and this spring, are the 2 semesters that I've tried these techniques. And you can see the numbers are pretty good. So the students really did feel that it was useful and that they enjoyed it. My group this spring was a little bit harder to impress, but still pretty good numbers, still pretty good. And of interest, too, was that at the bottom of the survey, I gave them the opportunity to check off if they thought it was not fun and interesting, if they thought they didn't get much out of it. And nobody either semester checked any of those off. And these are completely anonymous surveys. I also, on the back of the survey, gave them the opportunity to write some things that they thought, and saw some pretty good feedback. They really like those pre-recorded lectures that they can watch at their own pace, on their own time. And then the flipped model in general, they had a lot of really positive things to say about that as well. As far as student learning, I'll come clean right away and just let you know I don't have a lot of data from my own experience yet. I first tried this last semester after seeing a presentation by Linda Chang, and flipped one class last semester to this semester. I didn't dive in quite as much. I wasn't as fearless as her. Right? But so I'm still fairly early in this process. Also in nursing, our exam questions tend to change a little bit every year based on item analysis and current practice. So we don't always have that many questions that are consistent year to year. So for that reason, I wasn't able to get a lot of data as of yet. But the questions that I was able to analyze showed a really nice trend, and I'm really excited to look at other ways I can better evaluate the effectiveness. As far as moving forward, I do want to find better ways to evaluate the effectiveness of these techniques. I'd like to use clickers because I think that's a really good technique as well. What I've learned, I think the biggest thing I noticed is that it's very easy for time to get away from me, right? When it's a student-centered setting, then they're the ones driving a lot of the discussion, and I'm there almost sage on the stage, yeah. So with the students guiding the discussion, sometimes time can get away a little bit, and so I found it much better if I'm a little bit flexible, do the most important things first, and then be prepared to cut things or expand on things if need be. It is a lot of work, but the results have been really rewarding and really exciting and fun, so I'm eager to move forward, and I hope you'll be inspired to do the same. Thank you for your time. And next we have Martha coming up, who's going to tell you about how she's used these techniques in her history courses.
Hello, everyone. I'm Martha Brosna. I teach history at PCCC. And my case is a little different than from the situation that we find, like Katie and both Linda, in that history is not a major at PCCC. So the history courses that are available, that students take, they're doing it not because they love history, they're doing it because they have to take it. So it's a gen ed requirement, and oftentimes, they're not necessarily interested. So I figured I should reevaluate the way traditional teaching is normally done. Way back, back in the day when we were in college, typically what happened, you had the instructor stand, kind of like the way we're doing right now, and, bring about lecture, pearls of wisdom that all students then copiously copied, and they clung on to every word, of course. Now we know that's not the case today. Students don't necessarily take copious notes, they don't necessarily hang on every word that we say, even though we fool ourselves that they perhaps do or should. Traditional teaching also, again, back in the day, remember college, the professor was often very learned. He would stand there, it was usually a he, and you kind of almost felt intimidated about asking a question. There wasn't that sort of free flow of ideas. So the idea of asking questions during lecture didn't really happen. Even approaching the professor after class, he kind of seemed like a bit of an intimidating thing to do. So I figured I have to shake things up a little bit. At PCCC, our students are different, they're unique. Many of our students are non-traditional students, meaning that they tend to be over 25, not all, but many of them are. Many work full-time or part-time. Many of them have young children that they care for. Some of them have elderly parents that they care for, so they got a lot of stuff going on. Many of our students also come in, about 80% of them, not at the college level. They are either at the developmental level or at the ESL level, so that also kind of changes things up a bit. And this is something that's not unique unto PCCC. We know that younger students, yes, under the age of 25, tend to have shorter attention spans. That's just not our students, they're all students. And yes, we could lament about how terrible this is and how, we beat ourselves about the head because of electronics and gadgets, but the reality is that we have to reach them in different ways. We're not going to be able to change them. We have to change the ways that we are actually reaching them. So my goals for my history classes is to, first of all, generate greater student interest, move them away from simply, I'm here because I got to be here, and I hate history, I always hated history, let's just get this over and done with, right? I want to actually be able that they take something away from it, You're not going to love, maybe you won't love history, but at least maybe you'll find something interesting, some fun fact, some kind of nugget that you'll take away that it wasn't all that painful. Of course, I wanted to have more students, involved in classroom discussion. I didn't want to stand there and just lecture. I wanted sort of that feedback, that, back and forth. Clearly, I wanted our students, again, they're coming in, many of them at, below, college level. So part of my job, I see almost, is not just merely teaching history, but also teaching students how to study, helping them understand what it is that they're supposed to study. So I'm kind of teaching them, and I think we all do. We teach them how to be students. And finally, of course, everybody wants to have better papers. You want to read better papers, you want to have better exams. So that was also another goal I had when I initially flipped the classroom. Okay, there's been a recent article that came out in the Chronicle of Higher Education about what does it mean, what is this flipped learning, flipped classroom, how do we define it? And even the article itself gave definitions which are sort of a bit flexible, and that's kind of part of the thing about flipped learning and flipping a class, is that it's not one size fits all. There's not one way of doing it. It depends on the instructor, it depends on the students, it depends on the course. It depends on what it is that you want to accomplish. So, things like a flexible environment, trying to understand students, different needs, the way they learn. We know now not everybody's just, an audio learner, right? We need visual learners. We have students who need to have the information presented to them in different ways. Student-centered activities, making sure that, the professor's accessible. All basically moving away from the old school teaching that we remember, like back in the day. Okay, so what do I do? Homework. We've kind of talked a bit about homework, and yes, we all assign homework. The way I assign homework is that rather than sort of here, read chapter 16 for the next class, we all know we don't cover the entire chapter, right? So what I do is I assign specific readings from the textbook or from a primary source document. I mean, it is a history class. And I also complement that with some kind of short video. And I haven't had to do any Echo 360 lectures yet. I've been fortunate enough to have access, there's all kinds of like great stuff, done by the History Channel, Discovery Channel, biography. So there's a lot of good stuff out there that's done better than anything that I could possibly do myself. So, the kind of videos that I also use, not just from History Channel and biography, but also there's videos that are accessible to different fields, like the Crash Course series, which I think is really great. They have their own channel on YouTube, and what they do is they have a series of different videos, not just about history, but also things like chemistry and biology and literature, and they tend to be funny as well. So they're humorous and informative at the same time. Another site that I use is Education Portal. Their claim is that they want to actually create an entire, high school and, college course environment completely online, which I don't completely buy, but some of their videos are really good, so I use their videos, and they have videos on just about anything, accounting, algebra, science, you name it, they have it. Thus far, they've been free. Okay, so how do I know that students are actually doing the readings and watching the videos like I asked them to do? Well, what I try to do is at least once a week, I try to have them do some kind of in-class writing assignment that is based on the reading and or video that they had to watch. So naturally, the first or second time that I do this in class, students take out their phones and they start watching the video for the very first time, right? Because they don't think, watch the video, but they're actually expect that I'm going to do something with it. So, I mean, I'm fine with that. By the second or the third time, they realize I better watch the video in advance because she's going to make us write about it. So, what I try to do is give them questions that are fairly like open-ended. I'm not looking for the correct answer or the right answer. I'm looking for them to reflect on the material that they've, read or that they've watched. What I do also is I allow students, and I actually want them to talk with their neighbors. Okay, here's the question. Write about it for 20 minutes. Talk about it to your neighbor. Talk about it with your neighbor. Talk to the person behind you. Collaborative learning. The more you talk, the more you actually collaborate on this, the better it is. We know that students learn more from one another than they do from us ultimately anyway, and this kind of forces them, in a sense, to take control of their learning, become more active learners. So here are some examples of in-class writing assignments I've given, and again, they're not meant to elicit the right answer. It's more speculation. So I'll have them watch a video about like the lost colony of Roanoke. Nobody knows what happened to it. Even archaeologists, historians don't know what happened, but I like them to speculate on what could potentially have happened. So again, there's no right or wrong answer, but it's just I'm trying to get them to engage with the material. Another tool that I use, which I think is really awesome, are timelines. And these timelines, I found a couple of timelines which, what I do is I put my notes, but they're abridged into these timelines. And what I do then in class is whenever we're, whatever topic that we're reviewing for the day, rather than me standing up and lecturing, I make students actually go down the line and read an entry. So in a way, what this does is that the students who are more shy, the students who sometimes fear answering questions in class because I don't want to sound stupid or I don't want to give the wrong answer, this allows participation. This actually allows students to, even if it's reading something off the board, it kind of slowly gets them used to speaking out loud, which is something that they might, never have done before, or they're, in the past they've been too intimidated to do so. What this also does, the time toast, is that it's available to them at any time. So when there's an exam coming up and they want to access the timeline, they say, well, how do I get to it? And I say, well, go to timetoast.com and plug my last name in and plug in the subject. And you'd be surprised how many of our students don't know our names. They don't know our names. There'll be semesters where students will be like, oh, I took that blonde lady. I don't know her name, right? So in a sense, you got to know who your instructor's name. What is your instructor's name? What are you studying, right? They have to own their own education. They have to actually know who their instructor is. It happens. I'm sure it's happened to some of you, I know. Okay, so I also have, prior to an exam, I give students study sheets, right? You know, different, a list of terms and essay questions. And how do I inspire them to actually study, right? Because you give it to them and they do nothing with it, right? So what I do is I post the study guide onto Blackboard, and we have like a virtual study group. And I say to them, I go, just start posting. You know, start posting in the discussion board answers. You don't have to completely respond to an essay. You could do a partial answer. You could respond to a term. But the more that you actually write, the better it is, because I will give you extra credit points, and students could earn up to 7 extra points on their exam. So I say to them, look, you get an 80, you participated in the online study group, guess what? That becomes an 87, a B- to a B+. So it's kind of like there's the incentive, and also they don't realize it, but they're actually like learning something. You know, as they have to post, you know, it kind of goes down more deeply into the recesses of their brains. So what I like to think that, you know, that slide that I showed you previously from, you know, the article on the Chronicle of Higher Learning, I like to think that what I'm doing is, in fact, following that kind of flipped method, which in a sense is kind of a bit loosey-goosey, but in a good way. I try to make sure that the material is accessible, that, you know, I'm flexible, it's student-centered. So again, everything that I produce, all those timelines, it's all there, it's available to students on the LibGuide, it's available to them through Blackboard. The online study group, they're always available as well. I mean, they don't disappear, they're there. Students could access them, you know, even after the exam is over and done with. So what I've been doing is using Poll Everywhere, which is kind of nifty and fun, but by the same token, it's a little bit unwieldy, because what you have to do is you have to post a question, and then the students have to actually use their phones to dial in and text whatever the answer is, and it kind of, you know, students are like, what's the number? What do I have to use? So it becomes a bit unwieldy. So I'm trying to think of like alternate ways to kind of use something that's like clickers without actually using clickers. So Blackboard Collaborate's another one, like maybe with the whiteboard. You know, we could use that to interact. Quizlet's also another fun tool that I've been introduced to recently, and that's where students, instructors and students could actually make up their own like little flashcards to study, and that perhaps could be another like a little extra credit thing that they could do to inspire them to study and so forth. I haven't decided yet. Something to keep in mind, again, as all three of us have been talking about, we all have flipped our classrooms, but we all use different tools, and we've done it in different ways. And again, there's no one size fits all. You know, different subjects, different instructors. You know, it lends themselves to different kind of methodologies and tools. So that's something to keep in mind. One of the things I think that we would all say is don't be afraid to experiment. It's okay. If you're fearful that your students will rebel, I did a bit. So I did it over the summer because I thought to myself, okay, there are no student evaluations, so they can't actually, they can't rebel too terribly. You know, maybe they'll riot in the street, but at least they won't write anything bad about me. But it worked out well, so it's something that, I've been using now throughout this semester. And, I initially started out with a U.S. history class, and now I've extended it out to U.S. 2 and to Western Civ 2 as well. So don't be afraid. Be that fearless flipper. Thank you for your attention. There's my information. If you have any questions, contact anything like that. Linda also has all of the PowerPoints. She's run those off, so any information that you want to check out is there. And thank you for your attention.
I teach psychology, and of course, very much the same problem with a lot of people are there because they have to be there. It's a requirement for liberal arts at County College of Morris. And so psychology is a fun class. Most people think they're interested, but then they don't want to learn about the more technical part, So when you talk about people, for the flipped classroom, I'm interested in when you come back to class, how do you collect the assessment? How do you give credit or collect things like the pair exercises? I think any of you could answer this, but perhaps mostly about history. If you have them respond to questions or work collaboratively in groups of two, what do you collect after?
I basically say, take out a piece of paper.
Yeah.
Take out a piece of paper. This is what we're writing about. And some of them are like, oh man, really? It's like, we're writing about it. So yeah, I just do that. I give them 20 minutes. Right. I give them like an open-ended question. I'm like, this is based on the homework that you had, sure, from last week. Talk amongst yourselves. If you didn't watch the video, go ahead, use the phone. I try not to be like so dictatorial, like, oh, take the phone, because we're not going to win. We're not going to win like the phone wars, So what I try to do instead is like utilize it. So either, okay, you didn't watch the video, go ahead, watch it now. Or, if they have their phones on, just, okay, Google this or look this up for me. You know, if it's something, you know, I have something on the timeline, and they don't know what the word is. You know, I said, you don't know what the word is? You got Google. You know,
Sure.
when I was your age, I had to go to a dictionary. You know, it's like you get Google,
It's easy
so
for you.
appreciate it. So yeah, so I try to
But
so.
then what? That's my question, is how do you collect that afterward? Or do you give credit, or do you just have them speak about it?
I do collect it, and I usually use it as part of what I call class discussion / classwork. And I have changed
Right.
the percentages. So now the classwork and class participation is 25% of their grade. So I don't actually. I'll take attendance, but I don't say like you have to be here. But you know, because of this, it's kind of like you never know when I'm going to throw a question at you. You never know when I'm going to have you write something. So in a sense that makes them, or at least the ones who actually care, they do show up to class because you know they realize that's a quarter of their grade.
Sure, and you just check it off afterward. You just sit.
Yeah, I check it off. I usually give like check plus, check, or check minus. So I do actually try to do gradations, like you know,
Right.
to give them like if somebody did a better job, to give that kind of recognition. So.
And so you do it like once every week about.
I
and
try
then-
to do
yeah.
once a week. Yeah.
Okay, that's great because I've already started doing that without even knowing why I was flipping, you know. but
Right,
Just,
yeah, no,
just out
this
of
stuff, yeah.
frustration to get, you know, look, please, you know, I wanted some input and not to have it too
Right,
high.
it's like it's the
too high
please
stakes.
somebody say something. It's kind of like,
Exactly.
okay, you're not going to say anything, notes and write down. You know,
Right.
sit there and write, and then
And oftentimes, the interesting thing for me is I've noticed over the years that people write quite well in these things. They write, you know, in a way that often is better than writing in paper because they're just speaking what
yeah,
they think.
it's that whole idea of like almost like allowing them to brainstorm and allowing them that it's
Yeah.
okay. Like, you know, does grammar count? This no, just write your ideas.
And
It's
they
it's
really
okay,
write
free
fine.
flow. Yeah,
Yeah.
yeah, absolutely.
In your chemistry lectures, you prefer PowerPoint presentation or you like Blackboard to write on the Blackboard?
Both.
Both.
So I should clarify, the stuff I put in the video is different from the stuff I use in the classroom because there will be certain % of students who are really sharp. If I put the same thing, they will be bored and they say it's a lazy prof, right?
Yep.
So the video stuff is different from the classroom presentation. And then I ad-lib on the Blackboard all the time. So whatever is in the PowerPoint slide is not necessarily what I do on the board. That way they have to come to class every time.
Thank you.